The government said that there are no deaths due to lack of oxygen. Is this the lack of responsibility, lack of data, or sign of manipulation and running from responsibilities? Let's find out. Hello and welcome to Inventiva. This is Palak Yadav presenting to you today's big news. Amid rising prices, crores of rupees wasted on unnecessary surveillance of critics and dissenters, growing from lost loved ones and friends, increasing excise duty on petrol to fill government treasury, and anticipation of COVID third wave government has dropped a new bomb. The government has blatantly and outrightly denied the specific role of lack of oxygen in deaths due to the COVID-19 second wave. If the Minister of State is confronted about this specific role, he can twist words all day long. What is specific? And how does the government define the specific role of lack of oxygen in COVID-related deaths? Even an outsider who does not know Indian society knows that a number of people died because the state failed to provide primary health care. On Tuesday, Union Minister of State for Health and Family Welfare, Bharti Praveen Pawar, informed Rajya Sabha about no role of lack of oxygen in deaths. The minister, in a written reply, said that the guidelines on the standard operating procedure for reporting deaths were issued by the Union Health Ministry to all the states and union territories. All the states and union territories followed those guidelines to report cases and deaths because of coronavirus to the Union Health Ministry. These reports concluded that there have been no deaths specifically due to lack of oxygen in the states and union territories. The government, on the other hand, acknowledges the fact that there was an unprecedented surge in demand for medical oxygen during the second wave of COVID-19. These statements are contradictory and acknowledge only one part of a picture. Anyone who followed the news during the second wave can logically deduce discrepancies. The government supply of oxygen was unable to fulfill the demand, hence, people turned towards private centers and later black marketing. Law of demand states that an unprecedented increase in demand for medical oxygen will increase its prices. India has economic inequality, and people who were able to afford highly priced oxygen cylinders saved their lives, and those who couldn't afford died due to the lack of oxygen. It's as plain as the nose on our faces. People who lost their entire families to COVID-19 often think, why are they paying taxes? Minister of State Bharti Praveen Pawar, in a written reply, said that during the second wave, 2,35,986 deaths were reported as compared to 16,738 deaths in the first wave. It is official statistics that are checked. This number is a cardinal truth, but there are instances of underreporting of COVID-19 cases and related deaths. Hence, the statement is a blatant lie. A problem cannot be solved unless it is acknowledged. Underreporting of COVID-19 instances in rural areas add fuel to the fire. Next time a policy is made, adequate funds won't be disbursed to these areas because according to official statistics, there is no need. Who suffers at the end? People. Cases were underreported in areas like Ojhaul village of Uttar Pradesh, Beed, Satara, Buldhana, Ahmednagar districts of Maharashtra, and few areas of Gujarat. The absence of accurate data leads to inadequate responses to the problem. The government may disburse funds, allocate funds for improving rural medical infrastructure, hospital beds, oxygen availability, testing kits, etc. But unless the government knows how dire a situation is, it cannot allocate the optimum amount of infrastructure. Lying to people's faces is not accepted in a democracy like India.